A very good morning and welcome to Asake Online. You are watching The Breakfast Club. My name is Sizwakele Ndlovu, and on the program today, we are going to be having a COVID-19 update. We are in the fourth wave of the pandemic, and fortunately though, numbers seem to be coming down, but we cannot afford to relax and just think that the pandemic is over. Regulations have been relaxed, yes, but it is still imperative to just maintain social distance, sanitize your hands because COVID-19 is still here. I'm going to be chatting to Dr. Edwin Sibanda, and he's the Director of Health Services at the Bulawayo City Council, and he's going to be giving us a brief on the exact details on what's been happening in Bulawayo and the region. Dr. Sibanda, thank you so much for joining us on the Breakfast Club. And without further ado, please just give us an overview of COVID-19 in the region and Zimbabwe as a whole.
I must say that COVID-19 is currently the fourth wave. We think we're at the tail end of the fourth wave. As Bulawayo, we were recording very, very high figures, up to 300-400 in a day, but now we're down to single-digit figures. As of yesterday, which is the 26th of January, we only recorded 6 cases. And only worrying thing about it is that of late we have had the deaths have not decreased as fast as we would have liked. We do not know why, but you find that even if you record 4 cases a day, you may record a death. Whereas at the peak of the fourth wave, we would go as high as 10 deaths, but it will be 10 deaths out of 100 or 200 cases. That would be an acceptable percentage. But for now, we do not know why that the deaths have remained high. Is it people reporting late to health institutions? Is it because when they report to the health institutions, the case management is not good? We do not know. But we think we have far too many deaths for the number of cases that we are recording on a daily basis.
From our last conversation, the phases of the COVID-19 vaccination rollout had been conducted in phases. And at that point, the vaccination program had been open to everybody above the age of 18 years. What has been the response so far?
The response to vaccination in Bulawayo has been, I must say, good, fair to good, and sometimes we can even say very good in some areas, because we managed, especially during the third wave, I don't know whether it was the fear of dying that made people come forward and get vaccinated, or seeing loved ones die that pushed people towards vaccination. Such that, as I speak, Bulawayo is probably one of the few provinces to have exceeded the 50% target, meaning that, yes, the ideal is 60%, but when you are at 50% of the population, that target population, you feel that 60% is almost within reach. And we are one of the few provinces to have reached that 50% mark.
In terms of the under 18s, what has been the response and the uptake of the vaccination?
The extension of the vaccination program to the 16 to 17-year-olds, because those are the only ones that are under 18 who were allowed to be vaccinated using the Sinovac antigen, has not been as good as we would have wished. I would attribute this to 2 factors. First, the authority to vaccinate was quite delayed compared to the announcement. There was an announcement that these people were going to be vaccinated, but the logistics of how we're going to get these people vaccinated. For instance, when, according to the law, if you're under 18, you cannot consent to any procedure being done on you. So if one cannot consent, there has to be someone who gives the consent. That's an adult, a guardian, official guardian. And that the modalities of that took so long. If, for instance, the designing of the paperwork that has to be done had to be uniform and done centrally. You cannot in Pinga have them signing one paper and in Mrewa signing another and Bulawa designing its own. So the ministry had to design that and advise us which antigen to use. So that took some time. Unfortunately, the last quarter of the year is examination time because the 16 to 17-year-olds, the majority of whom are at schools, either at boarding schools or at day schools within the city. And some of them were in the exam classes because 16 and 17-year-olds are either in Form 4 or Form 5, or some in Upper 6. So all these people were busy with the examinations. And even as I speak, some of them have just finished their examinations. So we could not disrupt the examinations for the purposes of vaccination. So we think maybe when the examinations are over and the schools reopen, we will find them in a congregate settings, and maybe we may increase the vaccination coverage amongst that group, and that may push us beyond the 60% coverage for the population. The assumption is that these 16 to 17-year-olds are children of the vaccinated adults, but it may not be so. There is quite a lot of children here who are living in either child-headed families involuntarily, meaning mother and father have gone off to some neighboring country or even overseas, and the children are just attending school on their own. So at law, they cannot consent. That gives us a challenge. So others, the parents are in Joburg, and they may not understand or accept the vaccination for various reasons. Or the child may not be willing to be vaccinated. The parents can consent, but the child has to give their own assent. That assent may not be forthcoming. So you now have to negotiate with two people, as it were. And this is where that particular age group becomes difficult.
What information can you give us on booster shots and their necessity?
The booster shots, actually, what they are using the particular antigen, that is the vaccination, are so specific, such that when the virus mutates or changes in form, they may not be good enough to counter or fight that vaccine, that particular, the new variant. So if they cannot fight the new variant, they may be need to get an extra dose, such that the amount of antibodies in your body increases, that is in your blood, increase to a certain threshold. Because the antibodies, they tend to wane, or the levels tend to fall below a threshold at which they may be able to neutralize new variants coming into one's body. So these booster shots are there, and people get pretty much the same antigen that they would have gotten first time, meaning that if you got Sinopharm, Sinovac, Covaxin, you still get the same. So the antibodies take a minimum period of 6 months before they fall below a critical level, or to fall below a critical level. Therefore, anyone who either suffered from COVID in less than 6 months ago, or got their vaccination less than 6 months ago, are not eligible for a booster shot. But after 6 months, they may get them. And I'm sure we all know that in the developed world, people tend to talk of a flu shots just before the commencement of the flu season, meaning that the cold weather. So it's because these viruses keep changing. So it's very important to have these booster shots. The booster shots are available. We have enough vaccines in our stocks, save for the Covaxin, the Indian variant, which we're awaiting from Harare. We have been promised that we will receive it anytime soon. such that those that got the core vaccine initially and got the 2 doses can actually get their 3rd dose.
I like the comparison that you made to the flu vaccine that we used to get, or in developed countries that they used to get every year.
Yes.
You didn't get injected once and then you'd have immunity. It was specifically before
Yes.
the onset of flu season.
Yes.
So it's similar to the booster shots. To say.
Yeah. Essentially, most of the flu viruses are coronaviruses. So this is just a new coronavirus which was discovered in 2019, hence the word COVID-19.
What have been some of the challenges you've experienced in carrying out both the vaccination program and the general awareness of COVID-19?
The awareness program has had a lot of challenges, and most of them have been the fact that it's the rainy season for now. And if you can't gather people or be moving outside to talk to people, you can't be issuing pamphlets. So we have resorted to radio announcements, hoping that people will be tuned in at the time we will be talking. We have resorted to WhatsApp messages and websites, which we hope people are visiting. So that has been part of the challenges in terms of the awareness part. And we cannot go to schools because schools have been closed for a while. We all know they closed in December. And schools are very good places where it's like a captured audience when you're talking to school children. And those children will tend to share the information, either their colleagues or their parents or guardians. So we have had that challenge in actually making people aware of the vaccination. There is the issue of false information circulating in the social media. That has been very difficult to counter because some of it really looks genuine. If you're not careful, you may actually be fooled and believe that this is where the world is going. Some people actually specialize or have enough energy, time, and resources to generate that false information and spread it and let it go viral.
So where can people look to for credible information on variants and any other pertinent information?
We have got credible sources such as the Center for Disease Control of America, the Ministry of Health and Child Care website, World Health Organization, WHO. These are very credible sources. And even our own department, people may phone us and confirm that, is this available? Is this true? We have got a health promotion officer, or officers, should I say, whose duty is to communicate with the public on issues of health within the city. And they can talk to us anytime, inclusive of our corporate communications unit within the city of Bulawayo. They can share that information and research on it if they do not know.
Dr. Sibanda, thank you so much for taking time out to join us. Any last words for our viewers?
The last word that I have for the viewers is that, ladies and gentlemen, COVID-19 is there. COVID-19 is real. Vaccines help. They may not stop you from dying. They may not stop you from contracting the virus, but they will ensure that you have a milder form of the disease. Your chances of dying, your chances of transmitting the virus, your chances of contracting the virus are all reduced by the vaccine, and the vaccine is safe. Our clinics, the 19 of them, plus some satellite, or should I say mobile centers, are offering the vaccine, and the vaccine is free. Those that may feel very rich, we have a few medical officers or medical practitioners within the city who are licensed or authorized to issue these vaccines, inclusive of Mater Dei Hospital and a few others.
Thank you so much, Dr. Sibanda, for taking time out to have a chat with us. And that was a COVID-19 update from Dr. Edwin Sibanda, the Director of Health Services at the Bulawayo City Council. Please remember that we're still in the fourth wave of the COVID-19 pandemic, and remember to mask up, sanitize your hands, maintain social distance, and please stay safe. Thank you so much for watching Asake Online. My name is Sizwakele Ndlovu, and it's bye for now.